Hello, and welcome to www.hamiltonbackclinic.com. I'm Dr. Anthony Lombardi, and today we're going to focus on the benefits of laser therapy. By now, many of us have probably heard of laser therapy. I'm going to tell you a little bit about how it works, show you briefly how it works, and give you an explanation as to how it's successful. Now, this is the unit here. And the paddle is the main aperture. The paddle can go on the knee, can go on the shoulder, on the hand, the area of injury. It's very safe, and the most common question I get on the laser therapy is, how different is it from laser eye surgery? Because of course laser eye surgery is also wildly popular for cataracts and vision correction. Laser eye surgery is a surgical laser, so it's a totally different type of laser. How surgical lasers work, you have the laser, which is light, it's light energy. And light changes, or energy changes many different forms. So the light in the eye surgery goes into the eye, gets absorbed by the eye tissue, and gets converted to heat, and that's what does the cutting during the surgery. In this case, what they all call the cold laser, the laser therapy, the light goes from the laser, enters the tissue, gets absorbed by the injured tissue, and gets converted not to heat, but to chemical energy. And the type of chemical it gets converted to is the type of chemical that the body uses. It's called ATP. That's the same chemical that is used or is extracted from food. So we eat an apple, gets broken down in the stomach, gets digested, and now we have energy. Energy to walk, to run, to breathe, to play sports, things like that. In this case, the tissue takes that chemical energy formed from the laser and uses it to repair the injured tissue. Helps with tissue repair, helps with muscle repair, helps increase circulation, and that's how it's successful. Now briefly, I just want to show you how it works and what it looks like. We typically dim the lights when we do this, and I also use the eye protection. And typically, we can dim those lights, thank you. And you can see how that works. I'm going to turn it around so everyone can see here. And we see this is the red laser. Now there's two lasers coming out here. There's the red laser, which is a helium laser, and infrared. What I do after the laser therapy, it's followed up by a manual technique, which I call advanced muscle release or myofascial release technique, and that works very well, as you've probably seen in the previous podcast, very well with medical acupuncture or other types of techniques to not only improve the function of the tissue, but also improve the strength and the symptoms, decreasing the symptoms to improve the overall health of the tissue. So if you have any questions at all about laser therapy or any other of our services, please email us at info@hamiltonbackclinic.com. I hope this has been enjoyable. I'm Dr. Anthony Lombardi, and have a great day.